Well, I'm going to ask all of you to unmute yourself, unless you just don't want to, you don't want to hear your dogs barking or, because I got dogs and I hope they don't bark. They're actually 2 floors up, so hopefully you won't hear them barking. And I got a 19-year-old that's home, so hopefully he will. I've told him not to disturb me. But if you do have any cats or rabbits, I had somebody yesterday, that had a rabbit that jumped up in his lap. So cats, rabbits, children, parrots, who knows what, they're all welcome, so this is an opportunity for all of us just to, enjoy a conversation, hopefully, in free flow. So if you want to take Dr. Raduca, and certainly I'm going to ask you, unless you just don't want to take yourself off mute, this is going to be a very organic, I throw that word around like I really, I'm used to using it. It's something I've just picked up recently. Organic means kind of just, it's like the dirt, right? So we're all just going to play in the dirt for a minute. So there are, how many people are in the conversation? 9?
Yes.
Okay.
Mm-hmm.
So, I mean, I don't, for the first thing to do right now is just simply to give everybody an opportunity.
I got it.
Hey, Shannon.
Hey, 11 Shannon. Now.
Okay, so I want to just go. Y'all heard enough from me. Y'all know who I am. My name is John Bringo. I work for Council on Alcohol and Drugs. I'm the prescription drugs. Dr. Raduca told me a few months ago. He said, "John, you're everything prescription drugs." So that's my new title, everything prescription drugs. Okay, so I'm here to support the conversation and facilitate truly the conversation as it goes. So with that said, I want to open up the floor and allow space for everybody that wants to introduce themselves maybe say a little bit about why you're involved or interested in this work, and how you can, if you have a particular need in talking to your legislator, then you go ahead and say it now so Dr. Raduca can address that, because that's the most important piece of this conversation. It really isn't about learning about prescription drug abuse. It's about how you can take that information and then be confident to go and talk to your legislator. Because if you get the information, you don't talk to your legislator, it's not bad. It's just not meeting the focus of this event, this opportunity. So with that said, I'm going to open the floor. Greg, did you want to add anything to that?
You got it. You know.
Okay. So, no certain order. And again, nobody's forced to participate. If you don't want to share, so what are you going to share? You're going to share your name, why you're doing this work, or what's the interest in doing this work. And that needs to be short. And then the third thing is, if any kind of either legislative question or question about how to be successful when approaching your legislator, and Dr. Raduca actually will be addressing really that piece. So go ahead. Who's up first? Go.
Hey, I am Linda Verscharon. I am the Executive Director of the Family Alliance of Paulding and Drug-Free Paulding. We are a drug-free community grant recipient, excuse me, and been doing this work for like 33 years. Paulding, we were actually the second in the state back in the early 2000s to have a meth task force. So that's kind of where mine started, but I've always done work with drug endangered children and prevent drug, child abuse and neglect. So that's kind of where my heart is. So I am the director of we're a nonprofit, and we do drug prevention on the one side of the house, and then the other side we do supervised visitation. So we're working with the prevention side and then the after side as well. So that's why we really try and push our prevention. So actually I would love to be out of business one day on the other side of the house. But and as far as my legislators, I'm really pretty blessed. I'm actually good friends with 3 of our representatives, so I kind of get to talk to them at home. So that's good, but I always love to be a part of with John and Greg and see what's going on. So, and I am going to mute myself because I am recovering. I'm good, but not that I'm going to spread germs, but I still have a little bit of a COVID cough. So I'm gonna mute myself unless somebody has a question for me. So
yeah, thank you, Linda. And Linda, you're going to be, I'm sure you've already been an asset to Dr. Raduca, but in this conversation in particular, somebody like yourself, you just stood up and said, basically, you have the confidence, and you're another good touchstone, another diplomat in this conversation. So you can add, for those that have the need around talking to legislators, certainly speak up as you're willing to unmute yourself. So thank you, Linda.
No, that's good. And I have a couple of tips. So if anybody, wants to know anything, please let me know. Thank you.
That was a double thumbs up from Dr. Dukas. That's good. Okay, next.
We need to go kind of fast because we don't have too much time.
Yeah, so next is all you're simply doing is just, at least say your name, please. Again, you're not forced, but your name, and then what you're interested in the topic. And then if you don't have something about legislators, that's fine. We can just move up rather quickly. So I really don't like to call on people. So, this is not my style.
I'll go next.
Thank you, Shannon. Go.
This is Shannon Lawson. I'm the project coordinator of Upson GenRx, a prescription drug abuse prevention project in the Thomaston-Upson County area. I work for the Council on Alcohol and Drugs. I work for John Bringell and the great Dr. Greg Raduca. And I forgot the other questions I was supposed to answer. Oh, what brings me here is just, this is the work I do. It's the passion I do. And advocacy is one of the top things I like to do. I like to talk about the great prevention work that's going on in the community. And I like to talk about it with the people that can make policy change.
Thank you, Shannon. Okay.
Hi, I'm Lauren Stevenson. I'm a student at Georgia Southern and part of the Wellness Ambassadors, which is a peer education group. So we do a lot of discussions, not just about addiction and everything. We also do with like sexual abuse and things like that for the campus. And addiction is something that's personally affected my life quite a bit through multiple family members. So I've always been an advocate for, if you need opiates for pain management, being able to reduce that and use more natural ways to deal with pain and starting off slow to build up your strength. So I haven't ever dealt with legislators before, but with it affecting my personal life, I would like to expand my knowledge and ability to help people.
Awesome. Thank you, Lauren. Several levels of connection for probably many of us, not all of us. So thank you. Appreciate you, particularly the younger folks. I mean, the college students, the 20s to 30s year olds right now, you're greatly needed in time to support mainly. And I think what you mentioned there really in a lot of ways is the need for support among that your population. So thank you. Thank you. Next.
And I want to retire one day, so we need some new people to come in.
Yeah, I loved her voice. Her strength in her voice was wonderful. So,
Is there going to be Social Security by the time we retire?
Good question.
I wouldn't bank on
right now. It's 1-to-1. You better hope your person doesn't die.
Exactly.
I missed my opportunity to marry a sugar daddy. I married for love.
There you go. I love it, Lauren. You'll never regret that. I promise. Okay, next.
Well, I guess I'll go next. So I know John Bringell because I have the honor of being his program assistant. And so I also get to be the person that, we brainstorm together, look at new ways of doing things. We navigating this COVID world together. And so I'm on the call, one, to obviously learn from him, which that has been happening over the past year, but also to hear from other people how you go about connecting, how often you try to communicate with your legislators, and then, how can I say, show them that you can also be an asset to them. I would love to hear anyone's experience, a testimonial, just to kind of deepen that relationship. So.
Absolutely.
Thank you.
Thank you. Okay, and I'm not going to call, but I'm just going to say your name so you know that you're being recognized, and not to force you to participate. But Nakia, hi everyone, I'm Nakia. Oh, she's actually in the chat box. Nakia, you can't share by voice, so she wants to share by chat box apparently. Let me see.
Yes, actually, hi. My name is Joaquina Everett, and I work for the Office of Public Health and Safety, Violence Reduction here for the city of Indianapolis under the mayor, Hotsett. And it's a group of us that deal with many different issues within the county. And it just so happens that Southeast District has a big opioid epidemic. And I just want to learn more to see how our voices could be heard when we're actually doing the work.
So, all right, great, Dr. Duca. That directly connects, a need there for how their voices can be heard in Southeast Georgia. And you said what county is that again?
I'm sorry, it's Indianapolis, Southeast District, here in Indiana.
Oh, in Indiana.
Yes.
Wow. Okay. Okay. And thank you, Ms. Everett. Okay, and then Nakia actually introduced herself in the chat box. She said, hi, everyone. I'm Nakia Cross, and I am the past project manager for Region 3 at the Council on Alcohol and Drugs. I've worked with Nakia quite a bit in the past. I'm here to learn more about prescription drug abuse prevention, and so we can figure out how to incorporate it into the programs, into actually the program I wrote. Me and Fia and I wrote that program. So yeah, it certainly can be bolstered by continued learning from anybody that's involved in past project or any other project. So thank you, Nakia. And then I know Michael Carpenter, Dr. Carpenter. I know you're there. I don't know if you can or you would like to speak, but certainly I recognize you. And then there's a phone number 229-854-0243. So I'm just gonna hush for a second here, a few seconds, and then open that space up for those few that haven't introduced themselves, and then I'll move on if not.
Can we just ask who that person is so we'll know?
Yeah, 229. The phone number is 229-854-0243. This happened to me yesterday. I actually showed up as a phone number. I just showed up as iPhone on a Zoom call and not my name. So I was like, okay, well, that's me. But okay, well, I haven't had anybody take the offer to say who you are. So we're just going to call him 229. And Michael, Dr. Carpenter, I know who Dr. Carpenter is. I don't know if he's just had to step away or something else is going on, but Dr. Carpenter's got a tremendous amount of experience, not just in prescription drug abuse prevention. I think if I remember correctly, Dr. Ruka, you can correct me if I'm wrong, but he is an expert and done a lot of work in suicide prevention, particularly with young folks. So
I'm here, John, so I'm just listening to you.
Did I correctly introduce you?
Yes, and I guess I would add, I'm a national bullying prevention trainer too.
Bullying,
so
that's right.
That's kind of the two. Suicide and bullying and addiction kind of relate together too. But yeah, that was great. Thanks for doing this.
Thank you. Okay, so in my guide, the very first and most important thing was to allow space and time for people to introduce themselves, so we all can, have maybe a little bit of connection in that way. The next thing I want to do is find connection with how many of you, just put it in the chat box, have actually attended a substance abuse prevention advocacy day in the past. So how many of you have participated? Come to Atlanta, because that's the way it's always been done up until this year, of course. So how many of you participated? I know I have. And I know Isa hasn't, only because this is really her first year. So Linda has, Nakia can, let's see, Lauren, Brandy did this group. I have participated in other groups. Okay, all right, and live in DC, so probably have had plenty of experience in advocacy work, being an ambassador, such. Okay, great. So Lauren, okay. And then Shannon has Ciamara. I've never been able to participate. This is my first year. Okay. So, and Dr. Carpenter, I believe, I'm not mistaken, I believe he has. I'm going to say.
I have.
And then Miss Everett, of course, you're in Indiana. Have you participated in advocacy work there, going to the Capitol, in Indiana? She's either stepped away or maybe.
I'm sorry. Go ahead and ask that question again. I'm sorry.
We're asking the question of how many people have had the experience of actually going to the Capitol, their capital, in our case is Georgia, in your case is Indiana, and doing advocacy work, not just organically throughout the year, but actually on your, whether y'all have an identified advocacy day to go to the Capitol, or you just have been up to the Capitol and done advocacy work there in Indiana. Have you done that?
No, I have not. And that's something I'm also interested in learning. Since I work for the city, it's kind of like that's our work. And, we have like higher ups that deal with but individually, I email my congressman here, Andre Carson, and I try to voice through that way as a citizen instead of an employee of the city.
Okay. Well, in your case, it sounds like your legislator is or are, and then I think there's people like Linda who has an incredible relationship already existing. But the next thing that I need to do in the course of this conversation is encourage you. If you don't, I'm just going to use Lauren, you as an example. Lauren, if you don't know who your legislator is or are, because it'll be, if there's multiple, it's are, right? Then you need to go to www.openstates.org. And if Ziamara, can you put that in the chat box, or is that what it's called, the chat box? And then you can actually find out. It's real simple. Somebody like me that's not very internet savvy, but I'm sure you are, Lauren. Go there, just pop it in your zip code, and it'll pull it right up for you. I think, did I say that right, Dr. Raduca, Ciamara?
Yes, you said it perfectly.
Okay.
And
I
I'll
love
put that in the
politics,
chat.
so I've been following them for quite a while.
Okay, so good. So you're a good example to use because you've already done it, and So of course that's the first step in order to be really connected to them. You got to know who they are. So that certainly sounds like that. I'm going to make an assumption that Dr. Carpenter, I know Shannon, Isa, Nakia. I'm not totally positive with Nakia. You feel good about that? About going to openstates.org and finding your legislators? She may be on mute. I'm just gonna hope that she's heard that and that invitation. So of course, like I said, there's nothing more debilitating in this conversation, because I know for me years ago when I got involved with this kind of work, almost 30 years ago, when I started working and was able to go advocate for actually the same thing, Linda. I think you and I can't remember if it's 70 years ago. I was a trainer for 15 years for a Family Connection and Georgia Academy, and I trained on child sexual abuse, physical abuse, and of course I did a lot of advocacy work. But my point here is that I didn't know who my legislator was, and it wasn't until somebody helped me figure that out, which it wasn't that big of a task, but it was just like, oh, I don't know, and I don't want to ask. So that's first important, most important thing to know. And then of course the next step after somebody like Dr. Raduca, I need to make an appointment. So, it's not just good enough to know Dr. Raduca. I got to say, Dr. Raduca, I want to meet with you. And then, he's not a scary person, but he could be a scary person because he's a Dr. Raduca, right? And he's this person that's been doing this for a long time. I'm using this as an example because this is what happens with legislators. People think these legislators are like, not everybody, but they put them on this pedestal, and not that they're not important and shouldn't be respected. They should be greatly respected. However, they're human beings, and they just need you to call them and say, hey, their office, because you're not going to probably talk to them. I just need to make an appointment. And that's just as simple as that. Okay. It's like making a dinner reservation. Think of it that way.
Well, and they work for us.
That's right. That's right. Absolutely.
And John, can I just say one thing is
Sure.
that, like when you were talking about family connection and, we started, I mean, when you first start, or even if you're into this, you're so passionate and you're so involved with doing your prevention work where you are, but you don't necessarily know, you don't know what you don't know. You don't
Right.
know what the legislators and our congressmen and our senate, you don't know why you need them necessarily, or how they're gonna, help your job in prevention. So it's just like anything else. You don't know what you don't know.
And frankly, they, as I've met with them over the years, and even have conversations with local government people here in Fayette County. I meet them at I see them at the grocery store. I see them at the gym. I see them, different places. Or my family members have introduced them to me, say, hey, you need to talk to John because they're interested in this opiate topic. And, I just happen to live here, and I've got a very gregarious, approachable family members. And they say, hey, so when they talk to me, they're so appreciative because the way I share the information with them is not in a way of anything other than support. Hey, look, I want you to know this because you probably don't know it. So I want to help you understand. Dr. Duca, go ahead.
Just might say that by becoming a member of V4P, you'll be tuned in to other webinars we'll be having to prepare you to meet with legislators, especially for those of you who are new. But John, just to mention, we have about 10 minutes left, so we may want to turn to the discussion guide at this point, if that sounds good.
Well, no, I'm on this discussion guide. Matter of fact, I'm on number 6, and I was just about to ask, I'm poised to ask the question, what is the most important message regarding prescription drug abuse that you want to communicate to your senator? So that I'm gonna go ahead and I'm gonna start it off, okay, as an example, and that is my most important piece of information or issue is that needs to be communicated. I feel like needs to be communicated to our legislators is the effect that isolation, of isolation and being in your home with these drugs that are, prescribed and prescribed for people they should be in, and particularly for our youth, they're having access, and I'm using that word very, very directly, they're having access to a pharmacy in a lot of cases, in many, many, many cases, right in their home or in their grandparents' home, who now they're going to visit, more than what they used to before because they're, and so my concern has been even since March of last year that we better pay attention to that. And the numbers that I can share, through a share, the numbers prove that. The numbers have gone up drastically because of the amount of access that youth and people have in general, but particularly our youth have to prescription drugs. So who would like to go next? What is your message regarding the issue that you want to communicate to your senator and representative?
For me personally, to get your MD, you actually only need 3 hours of nutrition training, and a lot of medications that they use to cover up issues could benefited more from nutrition. Just a basic example, erectile dysfunction is the #1 indicator of heart problems. And if people, rather than taking Viagra, did that then and started changing their lifestyles, they wouldn't be getting triple bypasses after 3 years or whatever on this medication. And the same thing for opioids and so many other medications. Not to say that someone bipolar shouldn't be on medications or anything, but if doctors took more nutrition courses and learned about non-pharmaceutical solutions, it would benefit our society drastically.
Hey, Lauren, I'm going to take the opportunity, or I'm going to take the time to do this. I need to make sure you and I talk. Isa already knows where I'm going with this. I've just developed a whole PowerPoint that I'm presenting at the end of this month to the DBHED Prevention Conference. And one of the things that I'm promoting is what you just mentioned. So we need to talk again, but very quickly. So
Perfect.
Isa, make sure I follow up with Lauren, okay?
I'll send you my.
Okay, thank you. Okay, next. Your most important message the issue that you want to your senator or representative.
Hey, John, this is Shannon. I think to come back with what you were saying. I think as a community preventionist, it's important to remind our elected officials about the great community work that's going on, about the issues, like you said, the issues of isolation or the issues of access in general, and especially during this time of pandemic, and the ways that as community preventionists and as coalitions and collaboratives in the community, partners in the community working to promote safe storage and the use of our disposal boxes, that every community across the state has access to those, and the importance of disposing of medications when we're finished. I think those are great topics to remind our legislators. It's a very low-lying fruit that they can promote, that they are prevention champion in their communities because they promote these two topics. I just think that's very basic but vital information to share.
Thank you. Thank you. Okay. Linda, again, not making you share, but Linda, Kathy, Dr. Carpenter, 229, Nakia, 229, we haven't forgot about you. Okay. So the most important message regarding the issue, or the second question that I was going to try to get to before I moved the conversation to Dr. Raduca about speaking to your legislator, and that is the issues that are affecting your community, your family, friends, or yourself. So I think question 1 and 2 can be, you can see them the same, but maybe not. So just want to make sure that everybody has the opportunity to speak that wants to speak about this issue of most important issue.
And we had, just to jump in, we had someone write in the chat here. And it's similar to actually what Lauren spoke on. It says, how can holistic medicine be part of medical medicine?
Yeah, well,
and that's definitely a topic that we've discussed today.
Yes, and Ms. Everett, I see that came from you. And actually, I have a tremendous interest in that. And matter of fact, the way I term that is integrative medicine. And that's, I just developed this PowerPoint, this workshop that I'm doing the end of this month for DBHD for the prevention conference. And that's really the focus is, it's not doing without medicine. It's integrative medicine, which integrates these other therapies, these other approaches with medicine in support of medicine, or maybe even to replace medicine if that's appropriate when that discussion is made with the healthcare professionals. That's the most important thing to say, is that I want to be clear. These aren't decisions that you just make. I'm going to not take my heart medication because I'm now exercising and whatever else I'm taking omega-3s. So no, holistic medicine is something that, if you want to call it that, sometimes that turns people off. That's not to do that at all. It's to understand that we're more than just taking medicine. That, like Dr. Duca has, I know, said more than once, and that is, drugs are not the answer to all our human suffering, right, Dr. Duca?
I'm sorry, I was chatting with Ziamara about the next document in the chat box. So you
Okay.
repeat.
Yeah, no, just I know something that you have. I heard you repeat more than once, and I did pick up on repeat, and I've repeated over the last 10 years, and that is that drugs are important and need to be used as appropriate. However, they're not the answer to all human suffering.
Yeah, right.
Into this social norm that the answer is a drug, a pill, this. No, we need to think more broad than that to include the prescription drugs as they need to be included.
John, I'm super excited you're doing this. I mean, this has been, it's something that I do. And I'm just like so thrilled because, when you open up your prescription and you look at all the things that it can cause, okay, I won't even get on that soapbox. But for those of us who are not attending the BDH, where might we catch your presentation of this? Because I am like super interested in the integrative.
Okay, well, I literally just sent I'm doing a run through tomorrow. I just sent the PowerPoint to DBHD yesterday to Barbara Dorman. And as soon as, they sign off on it, all that, I'm going to actually, I just had a conversation with the leadership this morning at the council that I'm going to high power several of my trainings going into this to 21. The other one I'm going to high power is my culture competence class. Culture competence for the helping professional beyond race, creed, or country of origin. So these two programs, these two workshops, trainings, whatever you want to call them, I'm gonna be like finding some ways to offer them.
Okay.
Yeah.
Well, please keep us posted on that because I would be extremely interested.
Okay, Isa, Shannon, y'all help me remember. you know, there are people that I think that we know that and appreciate your support, Linda. But I know from what the cries I've heard, people really want to know, be empowered with solutions, not just let's talk about the problem,
Right.
you know, so let's talk about solutions, and we have some solutions.
And this goes back to what I said earlier is you don't know what you don't know. If this is all what your physician is telling you, you don't know that there are, you know, other ways. So I think that's
So-
important to educate.
You got Dr. Duke, I
Just
wanted to provide
just a couple of minutes left. So Ziamara does have the fact sheet for legislators that she can share. There it is. So we want to prepare you for your meetings with legislators. And this is something that DBHDD is currently reviewing. So we don't have the approval to share it with you today. But as soon as we do, we will let you know. If you're on our, if you're a member and you're on our email list, then we can send these out to you and you'll have this available. We would like you to tailor this to your local organization, put your logo on it, put your most direct primary concern on it about prescription drugs and opioids, make it your own, some local county stats, that kind of thing. So sorry, John, I just wanted to interject that before we turned it back over to the big room.
No, you're good. You're absolutely fantastic. So, yeah, well, now I'm actually going to, whatever time's left, Dr. Duke, I wanted you to go over any other speaking tips, tips to speaking to your legislator that you'd like to share. Linda, if you want to, you know, build on what Dr. Raduca shares, then just, I want to use this last few minutes of time to, you know, support the group with, you know, that piece.
Okay. Someone would, I guess, John, if you could stop sharing your screen and then I will start sharing if I, or Ziamara will share the tips to meet virtually with legislators. I'll see if I can.
Perfectly.
Okay, there it goes. I just have to find it. Okay. Can everybody see that?
Yes.
Okay. So this is another piece that we can share with you as soon as it's approved. And because this is COVID, this is kind of new for everybody, relatively new, starting with the last session to meet virtually with your senator or representative. And prior to the meeting, doing some homework. You don't have to be an expert, because if you give yourself a good basic, and I'm saying basic foundation in some of the stats, you're going to know a lot more than they will, because they deal with about 300 bills per year. And so it's very difficult for them to deal with everything. I am trying, there it goes. Okay, trying to go down a little bit. So arranging the meeting. Hopefully they are used to meeting virtually with their constituents, but be sure to tell them you're a constituent, because they're going to listen to somebody who lives and votes in their district much more so than they will somebody who doesn't vote for them. The exception to that, of course, is youth. They will listen to youth, especially from their district, because they don't often hear from youth. And it makes their job, to tell you the truth, more interesting. So there's always an opening if you can bring a youth or two with you, or even better still, if you happen to have a youth action team. You don't have to, but if you do, that's a wonderful asset, and introduce them to your legislator on the virtual meeting. And then you can email them this fact sheet ahead of time before you set up this meeting, which will hopefully be during the month of February. Sorry.
Okay.
That was Marcio calling about something. So
we are about to, we should be going to the main room whenever you guys can. So as soon as you finish, Dr. Raduca, we can head over back to the main room.
Okay, I'll wrap this up really fast. So here's some things to email. And again, we'll be making this available to you. So please don't feel like you have to take notes on everything or memorize what I'm saying. But be personal, be focused, have an elevator speech ready, a speech that you can give in 1 or 2 minutes. And there's an outline of the ideal meeting that will be provided for you. Tell a personal story if you can, like some of you and Lauren has been sharing today. That is a big door opener. And then show how to mention what's been shown to work to prevent what happened in that story in other states or in other parts of Georgia. Make the ask. This is essential. If you leave the meeting without asking them to do anything, you've kind of lost the opportunity. And you can't lobby. Most of you can't lobby. That's important. You can't ask them to vote yes or no on a certain piece of legislation unless you do that on your own time. But if you're on your organization's time, the most you can do is educate, but that's a lot. If you educate them about the issues, you're pointing them in the right direction. And that's a lot. You can't necessarily make the horse drink, but you can lead them to the water. And that's what education does.
Okay, I'm actually going to have to bring everyone back to the main room. I just want to thank everyone for participating in this specific breakout room. And we're going to join the main room now, guys.